Mzee Abdi is seated on a mattress in the middle of his grass-thatched house when we visit this afternoon. His sister Sadia is by his side, watching over him. Their father watches from the hut opposite his. After almost 90 years of living, he can't do much for his ailing son, but walks slowly to check on him from time to time. The family has just received the news that Mzee Abdi needs to begin dialysis treatment for his kidneys as soon as possible.
Ile expense ya kutafutia kukodisha hii gari all the way to Garissa or Nairobi inamsaidia mtu kufanya dialysis 1 year or 2 years even.
Abdi is among the 12 kidney patients who travel to Garissa County Hospital for dialysis treatment almost every week. Of the 28 patients seeking treatment, 8 are from Garissa while 6 are from Mandera County. The number of patients suffering from kidney problems in Wajir was the reason the first governor of Wajir, Ahmed Abdullahi, signed a contract to the national government to bring key medical machinery closer to the people of Wajir. Dr. Duhir Somo was the medical superintendent at the Wajir County Hospital when the dialysis machines were brought here. Since then, nothing much has changed in this renal ward. The beds remain empty and the machinery unused. The lack of personnel continues to cause financial and physical pain to many patients who have to travel far, even twice a week, to get help.
We have all the equipment which are working. Biomedical engineer is also been trained on how to use the equipment. But we need also the technical staff in terms of the nurses. In our case, we don't have a physician or a nephrologist who's supposed to operate this equipment. But in our poor resource setting, we are planning to train medical officers on short courses.
While 78-year-old Abdi waits for the services to begin, being offered less than a kilometer away from his home, his family will have to bear the burden of the frequent trips to Garissa for dialysis treatment.
We have a lot of renal cases, especially chronic conditions like hypertension, diabetes. Some of the complications of the complications of this disease is actually acute renal failure, or sometimes even chronic kidney disease. But the patients that we have, we just manage them. But when it comes to acute renal failure, there's nothing much we can do. We just refer the patients.
The local chief has taken it upon himself to ensure that patients suffering from not only kidney disease, but also cancer, diabetes and hypertension receive treatment at various hospitals across the country. This chief was not shocked when Mzee Ibrahim's son came knocking on his door, asking for help to get his father to Garissa for proper diagnosis as to why, though he is an asthma patient, his feet swell very often.
As far as the symptoms is concerned, this might have a kidney problem.
In a community that traditionally did not experience what we call lifestyle diseases like hypertension, diabetes or even kidney problems, some end up in hospital and are diagnosed with kidney issues a little bit too late when there is need for them to go through dialysis treatment. But with that facility here at Wajir County Hospital, there are no medical staff forcing them to go to Garissa and Nairobi counties, and for some of them they say this is quite an expensive affair.
From county to another county. Along as in Garissa Hospital, we end up to enter a private hospital and it's alliance. So we have paid 4,000 kufanya exam. So wakapima. So they say take the result back to the Garissa Hospital. Wakaangalia wanasema mzee is developing kidney problem. At the moment, and it's to make dawa, like in future, he might need dialysis.
I can realistically say probably the earliest can be maybe within 3 to 6 months, because the staff that we've trained have to come back. And probably we might even start with the one nurse that we have who will come, and the medical officers will go for a short course training at Kenyatta Hospital.
For Mzee Abdi Razak, the 6 months waiting period for the renal ward to begin work will be 6 months too late. His mother, 75-year-old Habiba Mohammed, succumbed to the disease early January after battling kidney failure since December 2012.
Hii ugonjwa si kitu tulikuwa naijua hapa kwetu. Ni kitu kipya kimetokea, imekuwa shida kubwa kwa sababu ikikuvamia na upate mtu yako apate ina gharama nyingi.
His is a story of almost hope, despair, and sometimes anger at the trials that he went through, trying desperately to bring his mother to access top healthcare in vain.
The time nilikuwa nampeleka, alikuwa siku 9 hakuongea. Kwa wiki nilikuwa nalipa 18,100 kwa wiki. Hiyo ni hakuna gharama ya gari ndani, wala hakuna dawa zile za nje. Kama kuna shida wanadungwa tuseme kwa mwezi mara moja ya kurudisha damu na nyingine ya kuua infection. Shindano moja ni 27,500 kila mwezi lazima apate moja.
Tears flow freely as his eyes become red when he narrates his tale of disappointment and despair once they got to India, despite the results from Kenya showing that all would be well to go ahead with the surgery. Doctors there ordered for fresh tests, and the most basic of these tests would change every bit of hope for mother and son.
Watu ya kupima, wale ndio walilipima kila kitu, na walipima mama wakanipatia report ya kwamba wewe na hata kuna damu nililipa 65,000 walituma South Africa, nikaongojea 21 days. Wakaniambia kila kitu mko sawa, muende. Blood group yako na ya mama aina yote ikiangaliwa mko sawa, unaweza kumtolea Vigo. Nenda umsaidie mama. Nikapitia ile ya kiserikali ili niende, nikatafuta ticket, nikaenda na mama. Nilienda kwa huko zaidi ya mwezi 2. Uzuri wa daktari wa India, hawezi kuamini makaratasi inayotoka mahali ingine, wanaichunguza. Wanarudia lote lile wafanywa katika nchi nyingine ama daktari mwingine alifanya. Huyo daktari wako unamwendea anakuambia hapana, mimi lazima nifuate kutoka nijue. Pale waligundua ya kwamba mimi niko A positive na mama ako O positive. Waliniambia bahati mbaya. Na nimelipa gharama. Makaratasi yao niko naye hapa. Niko naye hapa kwa nyumba. Haki ya Mungu. Nimesikitika, mama amesikitika, amevunjika morali paka tena kaanza ugonjwa upya katika nikiwa naye India.
The family chose to continue with dialysis treatments, but this time Abdi Razak found solace in a presidential decree that NHIF would now be accessible to all Kenyans.
Isipokuwa mtu akiwa na ugonjwa wa dialysis ama figo huwa anadidimia kila wakati, hawezi kukumaliza mwezi moja bila kulala hospitali. Haikuwa inanisaidia kubwa kwa upande ya malazi wa hospitali, lakini kwa upande ya dialysis walikuwa wananilipia 18,100 hiyo kila wiki.
He hopes that the renal unit in Wajir will start working soon so that other residents don't have to suffer from the same challenges that he went through. For those who are still alive like Wazir Ibrahim and Abdi, they can only hope that their troubles will be relieved soon. Leila Mohammed, NTV, in Wajir County.